Um, Besides any kind of psychological trauma, um, there's a lot of trauma that happens during impact sport as well, right? Physical trauma. We don't even consider it as significant. We don't even think about it. How important is that to take into consideration for certain adult behaviors?
So, in fact, we've learned now what boxing does to your brain. And boxing actually, in someone who boxes, especially without protective gear, boxing actually leaves a hole in the brain or holes in the brain. Okay, so we do know that there is a very long-term impact of boxing on the brain. The same thing applies today. We believe that football has potential to do the same thing, especially the more contact forms. I'm not talking about soccer type of football, but I'm talking about American football or rugby as they play it in the Commonwealth. These are high impact sports, and these are sports where you can sustain head injury, and not once but repeatedly in a mild fashion. So there is long term impact, cognitive impact, and perhaps behavioral emotional impact of having these injuries over time. And one therefore cannot afford to, what shall I say, neglect it. Now, how does one, as a professional, how do I zero in on this? It is when a person presents to me with problems in later life, and then I take a history and I ask, what did you do? And then I come to know that this was what they were doing. And in some ways, playing a sport of that nature, a high impact or a contact sport of that nature in early life, is similar to having a history of occupational exposure to a toxic substance, or indeed anything else. So it's about asking them whether they've done any one of these things, and then obviously taking that on board.
So your history taking must take a very long time, perhaps even up to an hour or more.
Oh, yes. And of course, you get better at it and faster with it as you get more experienced as a professional. But history taking is about the most important thing that most of us can do in this specialty. Famously, a very famous physician once said, "Listen to the patient, he's trying to tell you the diagnosis." So